Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode number 336. Yes, I did say episode 336 of the Ask Dr. Angela podcast. I am elated to have as my guest, Tsao-Lin. She has more than 20 years experience as an expert in alternative and Chinese medicine. She is the founder of Integrative Healing Arts, which utilizes Chinese medicine, acupuncture, and herbal medicine and energy healing to treat patients. I am so interested to hear a lot of what you have to say. So welcome, welcome, and welcome. We were just talking about all of your credentials. I mean, you're a licensed acupuncturist, you have a master's in, I think you said Oriental medicine, and I think you said sports medicine acupuncture as well?
Yes.
Wowzers. So let me ask you this. What brought you to this space of healing that you're in? Because I know that this isn't what you always did.
Well, that's a great question. I do get this a lot. It's really when you're looking to kind of do or at some point you realize that what you want to do or what you're doing isn't fulfilling. Like all of a sudden you find yourself on this hamster wheel and over 30 and you go like, wait a second. If I keep doing this for another 20 years or 25 years, I actually did a calculation and it was like, okay, if you work for 25 years with all and you work for someone else or, work in a corporation,
sure,
that what you get back is like 3 years of, vacation time off. And I looked at the ratio and I said, okay, this is, not okay. And wanting to have a family and really do something that I love. And what I realized, I knew I grew up in a medical family. I really loved health and medicine, but I didn't want to go into Western medicine. It just didn't attract me. And so what I did was I went, okay, what do I like? Or what do I love? I always loved massage therapy. So I went back to school. And while I was in school, learning we have to learn Eastern foundations, the more that I learned about it, the more I said, like, okay, this is something that I need to continue. I kind of knew like that was the next step. So really like the step was, just what I was doing working in corporate wasn't working.
Sure.
And then also looking at, the overall picture of health and how there's this broken and fixed model where, people want a pill, they want instant gratification, they're working themselves to death. Most people are not happy with what they do and they kind of feel like they have to do it.
Sure.
And the other thing in society with aging is with most professions, as you get older, you're less respected. But in Chinese medicine, the longer you're practicing, that the more, that you want to have someone who has experience,
sure,
because that's that knowledge. It's based on experiential medicine, like how many people you've treated. And so this was also, and also to learn, you never stop learning.
Sure. So let me ask you this, just for the listeners who may not be familiar, can you just briefly give like a very brief overview, Eastern versus Western medicine? Because I'm sure some people are like, what? East? There's a difference? But there is.
Yes. Very big. Yes, it's a paradigm shift. So in the, East Asian medicine or Eastern medicine, you really look at there is important the relationship between the let's say the practitioner and the patient. It's not transactional. We're looking at transformational. And so the power of the healing is really within the patient. The practitioner is someone that helps to facilitate it. And that's not to say that Western medicine doesn't do that, right?
Sure.
You can offer a medication, and that person has to receive it, and their body then uses it to get healthy. The difference is also the mindset, the feeling of, what can I do for myself?
Sure.
And in East Asian medicine, you're looking at always cultivating health and longevity. And so it's more than just that transaction of taking, let's say, a vitamin or medication. You're really
Sure.
looking at, what are you thinking? Like,
Sure.
what you think matters, the
Sure.
food you eat, your exercise, how your relationship is within a family, your environment, which is like the feng shui, and then also cosmology, like where we are, planetary, eating or being in alignment with the seasons and nature. And so there is that aspect of we're part of one whole.
Yes.
And everything is connected versus pieces of you, like looking at only your, certain blood test. And I mean, that's a piece of you, but you got to connect it to everything else.
Sure.
And so that's like a whole, we look at holistic medicine. We're really looking at whole with a W.
Yes. Yes. I really love what you said about just the relationship between the individual and the practitioner, and how big a role relationships play. But I also really like that you mentioned that the empowerment of patients and their ability to play a huge role in their own healing.
Absolutely.
Yes.
I mean, we know that like the chronic illness, especially in the West, and I'll say in the US, most of it takes place over years and years of like poor eating habits, lack of, stress management, not exercising, mental, like the thinking of, the constant worry.
Yes.
Right? So all of those things are preventable if you have habits and practices that have to develop over time. And what we see is when someone realizes, oh my God, my blood pressure, my cholesterol, I've got, pre-diabetes, now I have to do something, that it's always this kind of urgency versus over time, it's a lot easier to develop, practices and make adjustments. So it's not a struggle, because that's what you have is this like struggle to reverse something that has been going on for years and years.
Yes. Yes. And it speaks to kind of my philosophy of lifestyle, which it's not dieting. It's not, it's something that you do daily.
Yes.
Yeah. And it's not just, physical, but it's mental, it's spiritual, it's all of these things.
Yes. All of them are connected. They're not separated out.
Yes.
Yeah. Those practices every day. And it's really, we look at informed choices. So most people, I would say, and this is because of the culture, it's already kind of pre-done for you, pre-packaged. Don't worry about it. Just eat this kind of food or do this, follow this thing. And even in the, let's say the health industry, there still is that aspect of, oh, you just need to take these vitamins or, drink these shakes. Your food, even healthy food, is kind of like pre-packaged. And so there's the consciousness is not there. And so therefore they're to a certain degree, yes, making a choice to eat healthy, but also there's an aspect of not really understanding like how that affects their body.
Sure.
And then also checking in, because not all like healthy food works for people.
Right.
Or exercises or lots of things, right? We're really individual. And so that's And so
it is not a one size fits all.
Exactly. It's not cookie cutter.
Yes.
And and in fact, like the when you look at cookie cutter or standardized, it's really the lowest common denominator, not the optimal.
Right.
Right.
Right. You better preach today. Child, you better say it because you are just giving us a wealth of information. So for me, as an OBGYN, you know what I see a lot of. I see a lot of obviously pregnancy, women that are stressed, anxious, depression, dysmenorrhea. I see a whole spectrum of women with a variety of problems. Acupuncture. I want to talk about acupuncture because it's something that comes up almost daily for me. Acupuncture, whether it's going to be used to treat migraines, whether it's going to be used to help someone quit smoking, relaxation. Can you talk to me a little bit about acupuncture and the philosophy of acupuncture and kind of how it works? I know you can't give me a scenario that blankets everything, but just so that the listeners are a little bit more familiar with what acupuncture is and how it's used to treat certain things.
Yes. Okay. So acupuncture is what it is the insertion of tiny needles into meridian points, acupuncture points. Now meridians are these channels, and they're similar in where your chi and your energy flows. Like we have energy flowing through us all the time. We're energetic beings, and these energy lines, which are called meridians, are what I consider our biomaps.
Okay.
So what I'll explain is, before you're even born, this embryological stage, right? You have these this is more Western, right? Undifferentiated cells, and something triggers, like a spark of life that says, okay, you split in half, you split in four, something's going to become your head, something's going to become your feet, something becomes your arms, your legs, right? This is this information that's guiding the development in utero. What is that? Those are those pathways that are sending the messages to develop. Once you're born, you still have them, but pre-birth or prenatal and postnatal, you're different, right? You eat food, you breathe air, but those energy pathways are still there to tap into, to kind of, and it's also part of your entire nervous system. So research will show, certain points that they'll stimulate will actually light up in the brain. So it's like a point on the leg, which is referred to as the stomach, will actually light up in the brain, and then also will refer to the actual stomach organ, right? So with acupuncture, you're really tapping into the deepest part of the nervous system, the things that were there before you were born, right? To help to do a reset.
Sure.
It's like the back door. It's like a, back entrance to your, to a computer program to go back in there and say, hey, right. And so that's, what I explain, like, how does that work? Now, because it goes directly into the nervous system, that it helps to shift the body from that state of fight or flight, which is the stress state, into the state of relaxation. And literally chemicals shift, right? Neurotransmitters are being shifted to elicit that response. So when your body is in that state of real relaxation, that the healing process happens. And for the most part, we don't even know that we're in this constant low state of stress, right? Because people feel like, oh, stress is an event. But every time your cell phone beeps or you get an email, that can also trigger that, like, oh, or, thoughts. When you think, like, oh, this is going to rain, or is the weather going to be bad? Do I have to drive somewhere? Or those thoughts are constantly triggering chemicals. in the system. And once you get that feedback loop, and as you know from a more of a Western biological, physiological, you've got the amygdala, or the fear center, that is also receiving and interpreting your experience. And so if you're living in a space of vigilance, what happens is it's like a constant stress state. And then the body doesn't go into the deeper relaxation. So that's one way that it helped, because the body heals itself. You know, that we have this ability, the homeostasis, we have that ability to go into balance. And it's just a matter of being able to help that person along, right?
Right.
So that's how it works. That was like a good, and also definitely improves, you know, because it is also stimulation on the surface. You do have a response of the lymph. You know, the lymph system is just below the skin. You have increase in circulation. It has you also have a connection, a more mind-body connection, awareness. Like, oh, you start to feel something. You can actually feel the movement as the energy flows. You know, similar to when, you know, the hair on your arms raises, the pilomotor experience, that you're actually feeling your nervous system. And having that awareness is something that is important, because then you can go, oh, how do I feel? Most people ignore how they feel, right? They'll just keep on going.
Yeah, for sure. So nausea and vomiting in pregnancy, and from a Western perspective, you know, I'm going to say, oh, you know, small frequent meals, you know, maybe some ginger, maybe some Unisome, you know, acupuncture, first of all, safety in pregnancy. And, you know, if you have a pregnant or expectant mom that wants to utilize this, like roughly how many sessions are you looking at? What kind of, you know, benefit with regards to treating those symptoms are we looking at? Like what's the expectancy as compared to the more Western methods of treating this, which is a very common thing in pregnancy, specifically in the first trimester?
Right. Okay. So, and of course, as you know, some women like continue to have like nausea and vomiting.
I was one of those.
Like the nonstop. Okay, so you know, kind of act like how many sessions is kind of more of a transactional thing, like because everyone is individual. Very safe, right? Acupuncture is very safe for, you know, treating women that are pregnant. The practitioner needs to have experience for sure. And as you know, with any pregnancy, if it's a strong pregnancy, you know, there's just like nothing will really like unsettle it, right? So a lot of research, in particular nausea, vomiting, pregnant, and with chemotherapy. There are specific points, and the one of the points that is most used is one that is really a similar point for anxiety, and that's the one, you know, on the wrist. You know, they have those wristbands for nausea, also for seasickness. Right? And this is known as pericardium 6, and it is a point also for anxiety. So when we're looking at nausea, we're looking at like what is sending the message, right? Of that, the churning of the stomach. And then of course the worry part of it. I always look at nausea like, do you have low blood sugar too? Are you like eating regularly? Because that will also affect it. And then the other is looking structurally at the neck. Like I've had you know, patients that will experience migraines and then that feeling of nausea, vomiting. Right. You start to look at, okay, it could be their, you know, the neck, the phrenic nerve, or the basilar artery, you know, that kind of like something structurally is also affecting it. And also the diaphragm, like the tightness of the diaphragm kind of creating squeezing the stomach in pregnancy.
So let me ask you this, because just in talking to you, I can see the thoroughness and the completeness of what an encounter with you might look like.
Yes.
On average, like how long is a session with you? Because
so
you're very thorough, and I love that.
Yeah. Well, with each patient, so I treat each person. You get all of me. I don't have, you get time with me. So
Right,
the initial session is about an hour and 15 minutes to an hour because we go over
for
the
sure.
entire intake and really looking at like where the patterns are, because there are so many things and you start to tick off like, okay, I see all of these here together with this, and then you can actually look at, oh, I see a pattern emerging. And of course
Sure.
I'm asking questions,
Hmm.
and the part of the intake is really I'm looking at their their energy, their, we call
Sure.
their shen, like where are their eyes, or
Sure.
and their color and their overall, what is my overall impression of them, is a really good indication of what,
Okay.
like the bigger, are they fatigued, are they,
Gotcha.
there are a lot of different things. And so after that, I do, I check their pulse. I might, look at their tongue, because the tongue is
Yeah.
like your flesh, right? That's like
Yes.
a good, a good indication of what's actually internally going on.
Right.
And then I'll check different points to feel reflexes, certain areas that are guiding me towards where I believe this pattern is. And I get a confirmation, and then I will do the treatment.
Okay.
And so the initial one, mostly the first half an hour is really like going through, all different types of things. And the interesting thing is, and you probably have this too, is when someone fills out an intake, sometimes they forget stuff
Yes.
until you're actually, they're lying on your table, and I'm looking and I see like a huge scar. I go, oh, what's that? And like, oh yeah, I had this thing, emergency gallbladder taken out. And I was like, oh,
Right,
but that
right,
was in
right.
your intake. And like, oh, I forgot about it. And then you go, oh, okay. So it's really not just what's on there, but doing the exam, like looking
Yes.
at the person, their
Yes.
skin, right? Like, all of that. What's the elasticity? Is it dry? The coloration, like there are
Sure.
many different things that you have to look at,
Hmm.
that are giving you information.
Right. Wowzers. So let me ask you this. Irregular periods, painful
Yes.
periods. I see a lot of this. And I like that you are just in your training, because this is probably everyone wants to treat with a pill.
Right.
Take some non-steroidals, take a birth control pill. What is your approach to dealing with that and helping a woman to kind of better understand her body and how to correct these issues?
Okay. Yes. So let's say someone has, and it also depends on the, their age range,
Sure.
like what's considered irregular. So there is like a range of normal, right?
Yes.
Even if a woman skips a cycle, or it's a little longer or a little shorter, so long as it isn't, every
Yes.
15 days, right? So there is a
Right.
range. With a pill, it is really suppressing their cycle and kind of artificially creating one, but it is interfering with their, their own natural cycle is trying to go on, and then you have something that is disrupting that. So with the irregular cycle, I need to know like a lot of the history, and when
Sure.
has it always been this way, and
Right.
really from the very beginning, looking at what is going on there. Right? And so it could be coming from, we call blood deficiency, which
Hmm.
means they could have underlying, anemia would be blood
Sure.
deficiency, or poor circulation, right? There's also a lot of the, we call it, it's like a lot of chi stagnation, like emotionally, I'm looking at what
Sure.
else is going on. Because with women, as you know, our emotions are going to
Yes.
affect, stress. You could skip a period, or you could start bleeding through,
Yes.
right? All of those are part of it. But for sure, having any kind of pain and discomfort, is going to tell me a lot about what may be going on. And of course, first, I'm definitely going to be incorporating acupuncture because getting the body to be into that state of balance is, we know that the body wants to regulate itself. So that would be the first order, is we need to address their stress level, which would be called kidney channel.
Sure.
This is adrenal. And then the uterus is part of what we call the liver. It's guided by, so different organs, or we call meridians,
Sure.
are related to certain organs.
Okay.
And because those channels run through, and then they also were looking at certain, let's say, symptoms and patterns which are going to be involved.
Sure.
So with anything that's menstrual, we're always looking that for sure that the liver channel is going to be involved, most likely called the spleen channel is involved, and the kidney. Those are the three that are involved. And so we're looking at what, which one may be out of balance, and that is going to indicate also direction. I look at diet as well, because with women, many of them may be doing funny things with their eating, right? They're not eating balanced. They may be missing nutrients. And as you know, our American diet, they call it's a sad diet. The standard American diet is like, I don't know if you've heard that term.
I have not heard that term, but that's funny.
The sad diet. Yeah. A lot of, okay. And also a lot of processed foods have a lot of chemicals and things. So you start to look at all these, tick off, how's their food? How's the sleep, right? Because sleep is also related to the biological clock, right? The circadian rhythm. Women are, we have a moon cycle, so very much affected by environment, or not enough light or vitamin D. So there are lots of things to look at, where can we, make those adjustments. So that would be something. And then also making sure that there's enough circulation. Really, we're looking physically, painful periods. It's the uterus is trying to shed the lining. So the muscle itself is cramping.
Yes.
It's cramping. So we're looking at, okay, the muscle is not getting enough of circulation in order to do its job, right? And also dehydration. So you're looking at things that are okay, what can we, tick off?
Right. Okay.
Around. Yeah. So that would, and then also food stuff, if a woman has a lot of cravings before, look at, okay, a lot of salty foods are going to then create more cramping later on. So really, you got to look at the diet, the lifestyle, all of those things, and really huge difference along, because they can make those changes themselves, right?
For
they
sure.
can do it themselves. Yeah.
For sure. Menopause, symptoms of menopause, specifically hot flashes, night sweats, the inability to get good rest at night. How often are these women presenting to you for it? Sort of because not everyone wants to do, westernized hormone replacement therapy.
Yeah, because there are so many side effects of that, including, emotional depression, et cetera, et cetera. So very similar to a younger woman, we would treat very similarly, looking at all of those aspects. The thing is in you're looking also at, in Chinese medicine, that as you age, we call your jing, or your essence, starts to become depleted, right? And that's so you're born with this amount of extra.
Okay.
And when you stay up all night and ignore what your body needs, it's kind of dipping into those resources, right? And those are resources that are there to kind of help your immune system, protection, like your skin.
Sure.
So you start to, I also will look at how is their, the skin. Do they have good collagen, and really important digestion, right? Because if your digestion is not working well, then you could be eating a great diet, but you're not absorbing.
Sure.
And so those are like areas that I focus on. Definitely on the sleep. That's a really good indication of the biological clock that's there. And then making sure they're having omega fatty acids, right? Because
Sure.
those are the precursors for hormones. You got to make sure that they're materials that their body can then use. And looking at their stress level is huge as women are aging, right?
Sure.
There's a lot that starts, and especially culturally, as you get older you become invisible. And finding meaning. A lot of
Sure.
women are still, it's very masculine. They're go go go, and they don't allow themselves to rest and take care of themselves. So there are many those aspects, and I also will look at, there might be some herbal formulas to support them, right? But as women, most, I don't know if you recognize, most patients when they come to you, they're on a lot of medications. They're usually taking several pharmaceuticals, and so that becomes a little more complicated.
Sure.
What they can do to make those changes.
So let me ask you this: is the jing, as you mentioned,
Yes,
can that be replenished, or are you just born with a certain amount and then that's it? Once you deplete it, that's it.
that's a good question, because in the ancient, that we're looking at the ancient texts, they're pretty like, okay, you're born with this, kind of like that energy source or resource. And so by the time you get to a certain age and you stop growing, let's say, so in your teens you're developing your bones and you're creating all of the minerals in those bones that later on you're going to need them, right?
Sure.
So, right. Now, this is really ancient medicine. Nowadays, is it possible to replenish? I personally believe that you can. That it is something that you would need to really like work on.
Okay.
And that's part of that cultivating, like
Sure.
being able to have your, like, command your body in a way. And
Sure.
there is a very ancient technique which is spoken about in the Yellow Emperor's Classic, which is like from 300 BC, and they talk about the ability of healing yourself and living for like over 100 years. And it's that practice, it's definitely the mind body practice, but it is also this being able to connect to the universe. And as you know, we do have a cellular turnover, right? Every 7 years we replace ourselves, basically every cell. And interestingly enough, that is one of the cycles for the woman's cycle. It's a 7-year cycle, right? From 0 to 7, and then you get your adult teeth and hair grows. Then 14, you start your menstrual cycle. 21, you're like kind of fully formed, and 28, and by 35, it's like, okay, a little bit of decline happens and then by the time 49, your menses stops and you can't reproduce, right? And so this is something that's talked about in like ancient texts. They kind of look at these cycle turnovers.
Sure.
Now, I kind of think, if you have that turnover, why is it always on the decline? Why can't it be on the rejuvenation?
Right.
If there's no reason, why does it always go to like falling down versus getting better?
Right.
But I think it requires a lot of attention, I would say, to making shifts and changes. And really, the biggest part is going to be the mindset of that, where you are able to be more of a expansive.
Sure.
Right? And people say, well, what keeps people young? Like, okay, well, definitely, we know stress degrades us, right? The
Uh-huh.
stress hormones start to like eat away at your collagen, and you like your skin starts to droop. What keeps you young is curiosity,
Mm-hmm.
right? Always like, wow, what else is there? And there's more to like this, is this kind of energy of connecting to more. And then you have these resources that are gonna, you're allowing things to come in.
Mm-hmm.
And it's so I believe that it is possible to replenish, was it replenish your jing,
Sure.
or let's say stabilize it, right?
Mm-hmm.
Yeah, so that is something. But when somebody is at a point where we call it like they have devastated yang, or they really have really depleted themselves, that their body not being healthy makes it even harder to receive healing,
Sure.
right? So that, they need, if your digestion isn't working, then it's hard to actually absorb the nutrients.
Right.
And so you have to look at, you don't want to get to that point of decline. You want to make sure that you're able to be in a good, healthy state so that you can heal much faster and or what I would say is maintain balance, right? Always
Sure.
be able to go into that homeostasis or dynamic balance. That's the
Sure.
yin and yang, is the
Sure.
dynamic balance.
Now, let me ask you, speaking of healing, what role does energy healing play in your practice? And you also mentioned herbal medicine. What are some of the more, I don't want to say common, but some herbal medicines that, say, some of us may have heard of that are pretty commonly used in your practice?
Okay. So the, acupuncture, all of this is energy medicine.
Okay.
Right. Yeah, it's we're looking at the chi of the body, like Reiki is
Sure.
also that energy body. So just using different language. So
Mhm.
with the energy, when I look at the energy medicine, or what we're doing is I'm helping people to shift their perspective, right?
Sure.
Once you shift it, your energy changes, right? The more optimistic you are or hopeful, your whole
Yes.
vibration changes,
Yes.
right? Because this is also vibration
Yes.
medicine, right? You could actually, if you make somebody laugh really hard, as you know, like belly laughing, endorphins are like just coming out.
Mm-hmm.
And so, not to say that I have comedy, I do have comedy in my, we crack jokes, sometimes, you can, sometimes when someone is really, really like upset and crying, and you could say one thing and all of a sudden they go from like crying to like laughing, right? You can
Yes.
like things can like shift from
Right.
one to the next, to
Right.
pivot. And yeah, so with energy healing is really like I'll feel where their energy is
Sure.
and help them to also feel where it is. And that's that connection, that mind body
Yes.
connection. And okay, so what you were asking about herbs. Yes, there are many formulas, especially over the counter. In particular, people might have heard of something called yin chow san, which is for like early onset of cold, like
Mm-hmm.
sore, scratchy
Sure.
throat. It's actually it has the honeysuckle in it, forsythia and honeysuckle combination. You can see it in this product known as Airborne, right? So that over the counter
Yes. Yes.
actually, yeah, if you actually look at the ingredients, it basically has the same ingredients of that classic formula known as yin chow san, and then they added in some vitamins. So they took this classic
Okay.
Chinese formula, and then they pulled it together. So oftentimes people may be even using like using it, and they don't even realize
And
that
just don't even know it. Sure.
they don't even know. So in Chinese medicine, food is also, so we have
Mhm.
food medicine, right?
Sure.
Or medicinal food. So things like soups. One of the most common or interesting formulas is miso soup. miso with a little bit of the tofu in there.
Mm-hmm.
And that actually comes from a classic this physician. I can't remember. I have to remember his name, but he had this his book, which was known as like emergency formulas, emergency remedies to have up one's sleeve. And when they say like their sleeve, because they would have these long
Sure.
sleeves where they
Yes.
could like keep something in there in case of an emergency. And one of them is this miso soup, right? So they're using that with little scallion,
Mm-hmm.
the broth, and then
Yes.
so and a little of the tofu. So you start to look at when someone is starting to feel sick, maybe
Sure.
they need a little warm fluid. The tofu has a little bit
Mm-hmm.
of the protein, and
Sure.
then the scallion, the little bit of the onion actually opens up the sinuses. Right?
Okay.
So you start to look at food medicine.
Okay.
And in my practice, I like to offer people to try to drink some teas, like some basic teas to clear their system.
Sure.
Because with herbal medicine, you really need compliance, and that's
Mm-hmm.
very hard for
Yes.
people.
Compliance. Mm-hmm.
Compliance, and it's also not for ever. So it's not like the Western model is, okay, you're going to be on this medication. When do you get off? Is there an exit strategy? Usually there's not. Right? Exit strategy. No. So with an herbal formula, you're really looking at to get you to a particular point where you're stable, and then we're going to shift it.
Mm-hmm.
So that's with herbs, the person needs to start to take it consistently, and then we're going to move them through how they respond to, let's say, another formula. But in the meantime, they need to do some dietary changes. They're
Sure.
going to need to do lifestyle,
Mm-hmm.
lifestyle things as well. So common, I love to say, okay, have some, ginger and honey and lemon with
Mm-hmm.
water, hot water. That's great. The lemon is good for digestion and also helping the liver. So these
Uh-huh.
are very simple things for
Right.
people to do, and to drink tea. Like green tea is
Mm-hmm.
phenomenal, right? It's different than coffee. It's
Right.
slow release. It has lots of, so really like subtle changes.
Sure.
So that would be, my, those recommendations. And then when we get into more like herbal formulas, that I would really need to see more of the pattern, because someone could have a diagnosis. And
Sure.
this is in the classic of Chinese medicine, they say, same disease, different treatment, same treatment, different disease. So if for instance, someone, let's say for instance, one of your, like a woman, she has painful periods, and her underlying, let's say, constitution, I'm looking at,
Okay.
that she tends towards blood deficiency. Maybe she has thalassemia. Maybe
Mm-hmm.
there's a little bit of the sickle cell underlying. So I'm looking at, when I see something like that, I know that that is always going to be an aspect that is going to affect any other thing, whether it's a headache or muscle aches or shoulder pain or
Mm-hmm.
digestion. I'm always looking at that is playing a role, right?
Sure.
And so my treatment for that person is going to be looking at that aspect that's kind of always ever present, and then how that manifests into those symptoms that they're having, right? So you get a whole bunch of symptoms, that becomes a diagnosis. But symptoms are a indication that there's some other thing going on underneath. So I'm
Sure.
always looking at that. We call it root and branch, right? So the
Sure.
symptom is a branch, but the root may be a little bit different.
Sure. I've got to tell you, Chow, talking to you today has been very enlightening. And I really appreciate your approach to the whole being. Like individuals are not their ailments,
Right.
And so what I'd like you to do at this point is, can you please tell our listeners where they can find you, where they can learn more about what you do, where they can possibly even come and visit you in consultation? Because I am a huge lifestyle person, and I think that preventative is the best medicine. And so even though, you got me straight post call, post workout, and so I ran in here so that I could talk to you, but people that feel great but want to still maintain and even elevate themselves to like that next level of wellness, how can we learn more about what you do? How can we come and see you? Where can we find you?
Okay, great. Thank you very much. Well, what I want to say about the is that people really need to look at investing in their health now,
Yes.
not at the end of life where like
Right.
because it's like invest in it now, right? Like you invest in your
Right.
gym membership, you invest in like wherever, even it has to be that you have to matter, right? You're
Yes.
the most important thing now, not later on, because eventually that like the when I look at people investing in their health, they're kind of like, oh no, I don't want to spend it, I want to do,
Mm-hmm.
I don't need it, I don't need it. And then later on in life, it's like, okay, again, like at the beginning of what we talked about is things over time. And so
Yes.
now is really always the time is now to start. So if people want to find me, I'm on Instagram at Integrative Healing Arts NYC. And my website is www.integrativehealingarts.com. And so that's and my office is in Union Square in New York City. If people want to, have an idea of like what they can do, I think it's important to investigate now, right? Not when
Sure.
you're not feeling good, but
Right.
also when you're feeling good, your body is actually going to get better and better, right?
Mm-hmm.
Because I don't like this idea of like, oh, as you get older, decline. And oftentimes, what I'd say, my patients will say, oh, but the doctor said that. They ask me how old I am, and then they go, oh yeah, because, and I'm like, but that's not okay, because chronological and biological age are not the same for
Yes.
everyone. So once they kind of like, oh yeah, but your age, that's probably blah blah blah, then they've just dismissed you.
Yes.
And so important for people to be empowered.
Mm-hmm.
And if you don't, like that the doctor said, like, get another opinion, right? But
Thank you.
really, yeah,
Thank you. Yeah.
yeah, yeah,
I tell
totally.
people all the time, first of all, you are worth it. You are worth the investment. And
Yes.
secondly, just what you said, if you are not with a practitioner that kind of gets you, understands you, is willing to take the time with you, find someone else. I like your sense of empowering the individual, which is something that I do all the time. You have a choice in the matter because it is clearly your health.
Yes. And it's going to happen in your body,
Yes.
right? It's all like the power has always been there. And so that's also that there's also, that's a whole other discussion of that kind of
Sure.
patriarchy that is in medicine and how women are treated in
Sure.
medicine. That's a whole other kind of conversation.
Yeah. But it's okay because that's
Yeah.
a whole nother conversation
Yes.
that I would love to have with you. So
Yeah.
that means that I am definitely going to have you back on the podcast because we have scores more to talk
I would
about.
love that. I would love it. I would love
Yeah.
it. I just
Yeah.
love that the more people can take charge of their health destiny, that that actually also shifts their energy, right?
Absolutely. Absolutely. So we're going to wrap it up on that note. This again has been fascinating. I love your knowledge and your practice of, Eastern medicine. I love the way that you empower individuals, women, to take charge of their health. I love that you give people the sense of you can do this. The power is not with the clinician, it is within you. And we always have a choice in the matter. This has just been really fascinating for me. Everything from learning about the chi, acupuncture, energy healing. And one of the reasons that I wanted to have you on the podcast is you definitely offer an alternative approach to healing. So for that, I want to say thank you. So in closing, I'd like to thank Tsao-Lin so much for taking the time out of what I'm sure is a very busy practice to talk with us today about, alternative and Chinese medicine. You guys know me. I'm Dr. Angela, everyone's favorite OBGYN. You can find me at www.askdrangela.com. That's AskDrangela.com. There you will find all of my social media channels. It is always a pleasure to bring you the latest and the greatest. Until next time, remember to choose happiness. And from my favorite Life's Little Instruction book, and you guys know I'm an old gal. I've had this book since I graduated from college. But we're gonna go with lesson number 383 that says, understand that happiness is not based on possessions, power, or prestige, but on relationships with people you love and respect. Until next time, I'll see you on episode 337 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.